Welcome to our second Align with ALYN webinar. We are so pleased that you are all here to join us. I am sure Dr. Gefen's presentation will be fascinating and thought-provoking. Before we hear Dr. Gefen speak, I would like to introduce you to our board president, Joanne Bly. Joanne has served as president of the American Friends of ALYN board since January 2021 and came to that position after over a decade of volunteering on the Wheels of Love bike ride. Since assuming the presidency, Joanne has worked alongside me to help improve AFAH's governance, ensuring that the board is engaged in best practices and that we are doing everything possible to further our mission. So, Joanne, I turn the floor to you.
Thank you, Mayanne. I am pleased to welcome all of you to the second Align with ALYN series, where we host distinguished speakers to provide updates on all the initiatives at ALYN Hospital, funded in part by you, our donors. As the recent New American Friends of ALYN branding in the banner above my head states, our support, their success. So in the spirit of showing what our support has accomplished at ALYN Hospital, I am thrilled to introduce Dr. Naomi Gefen, the Deputy Director General of ALYN Hospital Pediatric and Adolescent Rehabilitation Center in Jerusalem since 2012. Dr. Gefen is responsible for the allied health clinical services, including occupational and physical therapy, speech and language pathology, psychology, social work, and education. She is a principal investigator in the Helmsley ALYN Pediatric and Adolescent Rehabilitation Research Center, where she heads the domain of novel technologies for children with motor and cognitive impairments. Dr. Gefen will be discussing reaching rehabilitation goals through remote therapies. In other words, how ALYN Hospital is working to develop the most effective therapies for rehabilitation. Please welcome Dr. Gefen.
Thank you so much, Joanne. Thank you for the warm introduction. I see some friendly people that I know here from the ride, so it's very exciting to be able to share what we're doing at ALYN with you. So let me share my screen. Okay, so we're going to be talking about telerehabilitation and what we did, what we started doing even before COVID, during COVID, and what we're doing now after or post the majority of COVID. So we're going to talk about the challenges and potential solutions that we've been working with together with the ALYN Innovation Center. And all of this is, we're looking at the research done through the Helmsley Park Research Center. So when we're talking about telerehabilitation, just to make sure that everyone knows what we're talking about, it refers to the use of information and communication technologies to provide rehabilitation services to people that are remotely in their homes or other environments. So you would actually think that kids would love it because it involves everything that they enjoy, screens, and that parents would hate it because it involves everything that parents hate or that they're apprehensive about. Screens, a lot of screen time, but it's really not so clear cut. So I want to share with you what happened in ALYN immediately in March 15th to be more exact. We started letting patients go home and sending patients home because of COVID. And we immediately had to transition to using remote therapy, as did the rest of the world. We didn't have training, but we had to start immediately. So we had physical therapy, occupational therapy, speech and language, psychology, and physicians all using remote rehabilitation in individual sessions, group sessions. We did multidisciplinary clinics. And at the beginning, we started using the basic platforms, even starting with the phone call to see how kids were doing, WhatsApp and the WhatsApp videos that you can use using WhatsApp, FaceTime, that's more popular in the United States, and using Zoom. We had to get the permission from the Ministry of Health, but the permission was given very, very quickly for everyone because it was very soon realized that we had to give service, and so making some restrictions using Zoom, for example, not enabling recording sessions, not enabling chat. We were able to use Zoom immediately. And the following day, we were able to start using it. We got support from Microsoft, and I'll talk about that maybe a little bit later. So we decided immediately that we were gonna follow what we're doing, just so that afterwards we could look back and see what we could learn from what we were doing. So we looked at the first 5 months, March to July, and we started recording what we were doing. It's called a naturalistic study, following what we were doing anyway. We had 144 children that participated in it, 61 therapists. Over that time, we performed 2,500 therapy sessions, and we led 2 focus groups, one with therapists and one with the patient, the parents, and the children themselves, to try and understand what was working and what wasn't. The results of this naturalistic study can be found in a paper that we submitted, that we published, called Lessons Learned During a Naturalistic Study of Online Treatment for Pediatric Rehabilitation. So when we did the focus groups, we wanted to try and understand what was working. And the way that we did that is we looked at through a SWOT analysis: strengths, weaknesses, threats, and opportunities. And I want to go back a minute. And what we essentially found, I mean, I don't expect you to be able to see everything written down here. This is adapted from someone else, but it covers everything that we found in the focus groups. We thought it was very clear that personal attributes were very, very important to see if it was going to succeed or not. The access to technology at home, and if there were people at home that could help the children use the technology. And we can talk about that a little bit later about some anecdotes. There was an issue of environment, and children that had been seen in the clinic, and that's where they got most of the therapy. Transitioning to being treated at home had lots of challenges. One being access to equipment. If, for example, if we were working on range of motion and we needed a specific type of equipment, they didn't have that at home. And so almost every single therapy session started with making sure that we had the right equipment, and it could involve going around with the video at home and trying to find the equipment that we could use. For example, if we needed some, I'm forgetting the word, I'm sorry. We took bottles with 2 kilos, for example, each one being 1 kilo, to be able to use to lift weights, sorry. And looking around to make sure that the environment wasn't dangerous for the child. But what we found, looking back at that SWOT analysis, what we found was that once we were able to look at the environment, we could help them set up the environment so that they could practice in between sessions, which turned out to be an opportunity that we found. After the naturalistic study, and also parallel to it, ALYN has become very much involved with the telerehabilitation since COVID and after. One of the things that we were very much involved in was leading a policy paper of the Israel Society for Occupational Therapy. ALYN was approached, and I headed a group of national therapists from the Ministry of Health, Ministry of Education, therapists from the field, and we put together a policy paper that was accepted by the Ministry of Health, and it was also published, and you can find it here. And it talked about it was very early on in June of 2020. We started writing the paper and finished it a month and a half later, and it was already published in November. So the lessons learned and the policy of doing occupational therapy remotely in Israel is based on this paper that that was led by ALYN. Another area of our involvement is the Ministry of Health, the Digital Health Work Group. I'm a leader of the Ministry of Health, the Digital Health Work for Online Therapy for Children and Health Professions. We have in that group 100 participants from different HMOs, hospitals, the different ministries. We've had 8 meetings of peer learning. And what we're working on now are 3 instructional videos together with MESSER, which is medical simulation. And it's a group from Sheba Hospital. And we're putting together 3 instructional videos that will talk about the challenges doing remote therapy with children. For example, the challenge of not having the hands-on. Children in PT, OT, but especially in PT, we found that a problem, that physical therapists give support, for example, for a child sitting next to a chair, sitting next to a table and needing help being held to be able to sit properly. And you had to be able to explain that to the parents on how to hold the parent, how to hold the child in the correct way. Another thing that we're working on for a national, international dissemination, again, very early on in May 2020, an e-health summit for pediatric therapists, a global conference. It was organized by women from New Zealand and from Canada. And there, within the conference, there were about 90 presentations, and 10 of them were ALYN, and the work that we were doing in ALYN. Physical therapists, psychologists, physicians, occupational therapists, all presented the work being done in ALYN. And it was a global conference, and it was run 24 hours for 3 days. Another thing, the work that we did in ALYN was presented in the occupational therapy conference in 2020 in October, in the physical therapy, the physical rehabilitation conference in December, and also in March of 2020 in the Digital Health Research Club. Pending is we're waiting for a grant on to look at hybrid telerehabilitation. One of the conclusions when working with telerehabilitation was that telerehabilitation is one thing, but if it is possible to do it in a hybrid mode, meaning that you would have some of the sessions in person and some of the sessions remote, seems to us to be the better solution. But we want to look at it, and that's one of the studies that we're going to be doing in Park together with Sheba Hospital. Okay, so when trying to work with the families in telerehabilitation, as I said, we started with Zoom, but we looked with in-house at ALYN and the different startups that we're working with to try and see if the programs that we were helping develop within ALYN could help us during these times. So we wanted to identify the opportunities using these programs and to see how we could use it for remote therapy. You'll hear more about ALYN in one of the next Alliance for ALYN. One of the companies that we work with is Augment Therapy. It's from the United States. And what it does is you can see that there's a possibility of working with a child remotely or in person. And it works on gross motor, fine motor. And I want to show you one video. This does not have sound, so don't expect to hear sound. You can see that the therapist on the top, the child, you can see the frog on the bottom telling the child what to do. This is all in English. Now, working with all of these companies coming from the United States or Canada, language is a barrier. So they together, and with a lot of input from the therapists from the hospital, we have worked and developed a Hebrew version of this. And
שלום, בואו נתחיל. הרימו את הידיים כלפי מעלה, ישר ככה, והורידו אותם
So
חזרה.
it is now
וזיזו
translated
את היד
into
ככה
Hebrew
2
because
פעמים.
that's
מוכנים?
one of
צאו
the things
לדרך.
that the therapist said that they would prefer to have the
אני אוהב לראות
programs
כמה
in
קשה
Hebrew
אתם
so that they
עובדים.
didn't need to
2.
translate it for the children. So this is the outcome of trying it out and being able to translate and get it into work for remote therapy. Another company that that we're starting to work with now, but the motivation for this company was COVID and the remote therapy. APT is an active passive trainer. You can see here on the bottom, and they are going to be now together with us. We are helping them develop a children's version, but it will be connected with motivational games. And the reasoning behind that is that the active passive trainer is it's like a bicycle that you can use your hands or your legs. And for children, it seems to be very boring and they don't really like to use it. So they're trying to find a different way to have the children use it. And these motivational games will also be accessed through Tele Rehabilitation to be able to use that within the program. Another company that we've been working with is Cuniverse. And Cuniverse is picture a large iPad and that you can place either on the floor or on the table on the wall, and you can work on balance or range of motion or other therapeutic goals. And this too can be used through telehealth, telerehabilitation, excuse me. And this is also something that during COVID, we've been working on. Cognishine is another company that this also is an Israeli company, started during COVID and used as a beta site in the New York area, actually in schools. It works on 4 different areas: cognitive, speech, communication, and social emotion. And what it does, I want to see if I can show you. Just one second.
All right.
So now this is in English at the moment, but it also has Hebrew. Speech therapist.
Words, and we're going to do it in all the positions. And I think we'll do 1 and 2 syllable words. Okay.
Just want to show you 1 second.
All right. Lay. Now you say it.
This is just an instructional video to show.
Lying.
Just 1 second. That you can use it either in person or remotely.
Olive.
Okay. So in summary, telerehabilitation, remote therapy, there's different terminologies. It's here to stay. It was here even before COVID in remote areas. Australia has a long track of using telerehabilitation. Places in the United States that are not close to urban areas have been using it. The basic way to use it up till now have been either telephone calls or video calls or asynchronic use, meaning that communication back and forth between the therapist and the patient or family, but not at the same time. To be able to make sure that it works properly, we need to make sure that they have the special equipment, programs, and the apps that are ready to use remotely, because we want to make sure that the kids are engaged. An important part is being able to monitor what they're doing. We're not sending them home to just do something that just whatever they want. We want to make sure that it connects to the goals that we've set out for them. And it enables them age-appropriate activities. And we want to be able to evaluate the effectiveness of the different systems. So that's some of the things that we're doing now in PARC, being able to look at the different programs and study their effectiveness and compare in person to remote to see that it is as effective, doesn't need to be better, but as effective as in-person therapy. So if you remember this, again, not so clear cut, telerehabilitation and the involvement of screens. So thank you very much. Questions?
I have a question. Can
Yeah.
you hear me?
I can hear you fine.
Great. I love that you talk about publishing papers on this and spreading the word, because I know a lot of our donors are here in the US and they say, why should we support a hospital in Israel when there are so many worthy hospitals here in the US and needy children here all over the place? And so I'm glad you highlight that you're publishing your results and you've even spread it internationally. Do you get questions back, or do you hear how other people are using the work that you've done?
Yes, I think one of the easiest ways to see that is to see if the papers are cited. So that's an easy way. So I was just looking at that the other day, and it has been cited, and it's used for other researchers to help develop their programs. And I do get emails asking what technologies were used, and also to the other lectures that we've done have exposed the different companies that we're working with, and we're getting questions about that. So we can also help the companies that we're working with, and so that they'll be also used in remote therapy abroad.
I'm going to let Mark and Vera ask a question.
Now it's unmuted. Can you hear me now?
I can hear. Hi, Mark.
Hi, Naomi, how are you?
Fine, thank you.
Good. Actually, I have 3 questions. I'm very interested in this subject.
I'm going to write it down then.
My first question is if the remote teaching in the rehabilitation is on one-on-one, and to what extent is it bi-directional? And do you get feedback from the patient or the person that needs the rehabilitation? And how do you progress? How do you monitor progress?
Mm-hmm.
Number 1. Number 2, there's now a whole development of measuring remotely vital statistics through body wear or other measurements. To what extent is that important as part of your solution?
Mm-hmm.
My third question, and it comes back, to the idea I presented a few years ago that actually led to ALYN Innovation as a new way to create additional income, because ALYN is sharing its expertise with all these beautiful startups, and like you, they need the startups and the startups need you, so there's a real partnership. So the short of my question is, what's in it for ALYN in terms of US dollars?
Okay. I'm going to start with the last question, actually, with what's in it for ALYN. You will be hearing very soon, I think, about ALYN Innovation and the companies that we're working with there. On one of the slides that I showed before, I did mention that the startups that we have signed contracts with them. And I will let Aryeh Melamed, who is the head of the ALYN Innovation, talk about the partnerships that we have. Some of the contracts involve royalties to the program. Some of them we get funding for the studies that we're doing. So the partnerships do end up with dollars at the end of the day for ALYN and for the work that we're doing together, because as you rightfully said, we're sharing a lot of our knowledge, but we are sharing it with, we're getting paid to share that knowledge. So that's the last question. The first question is it one-on-one or group? It's both. I can give you an example of group therapy. The school in ALYN closed down during the lockdowns of the hospital, and an occupational therapist was working in a class before COVID, and it was a group session, and it used a lot of elements of mindfulness. And so these are kids connected to respirators, all of them at home, each of them set up with the computers. Some of the computers given to us by Microsoft. I told you before that they supported us. And so in that aspect, it was a group therapy led by the teacher and the occupational therapist. And it's two-way. I mean, at the moment, the way that we have it set up now, I can't see the participants, but the way that we did have it set up, the children can talk, their peers can hear them, and it's a group session. In other instances, it's one-on-one, just like it would be in the clinic if they were in ALYN. And the way that we can see if what we're doing is good is we have baseline measurements. If the goal, for example, I'm just going to take something easy that you can relate to. The goal, for example, was to increase the range of motion of the knee after an accident. We can take the pre-therapy, middle therapy, and post-therapy, and some of those measurements can be done either remotely or in person, depending if the child does come. Your third question talked about wearables. These are companies that we are in contact with at the moment. We're not using wearables, but in the near future, we will, to be able to monitor the kids' progress and how they're working during remote therapy. So I think I covered all of your three questions. Okay, and I am seeing here that Morit is giving us another scoop. One of the things that we're looking at came up from one of the other PIs, a neurologist. We're working with companies to try and analyze through remote therapy voice, and to see if there are changes in voice due to therapy. This is one of the things that we are in the midst of developing now. Other questions?
No, Naomi, I see you have other questions here. Question from Deborah. Can you share a story about a child who had great success using remote therapy during COVID?
Yeah, for sure. One of the children couldn't come to the hospital and was at home. She had undergone surgery, and the problem was the surgery that she underwent. It was elongating tendons, and it needed rehab immediately after surgery. And these were children that were inpatient, but they had to be sent home because of COVID. And even though it was the children continue with telerehabilitation, with a lot of input from the parent as the extended hands of the therapy, the child was able to gain the elongation that was needed after the surgery. That's one case. Another case is of a teenager who had injured her shoulder and needed to work on range of motion of her shoulders to be able to brush her hair, to be able to get dressed independently. And this was a child that from the videos that the therapist did, saw that there was very little to work with at home, but the therapist was very, very innovative and said, okay, let's go around the house. Let's find a specific setting. And he set up the child to work in front of a mirror so that she could see herself, and gave tips of specifically how to, for example, if they wanted to make sure that she stood in a specific spot, they put a line on the ground. They took the bottles to use as weights, and he was able to increase the weights and look at the child through two different videos to be able to make sure that the alignment of the way that she was standing while lifting her hands was correct. And when the child came back, when the lockdowns were finished and the child could come back to therapy, the teenager had regained all range of motion.
That's great. That's good examples. And what is the feedback you are getting from parents?
I'll also relate to a question that I see also that came up here. From the parents, it's a hard buy-in. Parents thought, or still think, some of them, that that in-person therapy is better than remote therapy. We are able to show them that the strengths of in-person, of remote therapy, and how it can be to benefit of them. Also to save them time, to enable it to be at a specific time for them. For example, I'll give an example of psychology. When the child is as an inpatient, and the parents have sessions with the psychologist, not always, there's not always possible that both parents attend the sessions. It can be in the middle of the day when one parent is working. So during the COVID, and even now, the psychologists have set up therapy sessions at a time that is more convenient for both parents, and so that both of them can be part of the sessions. I will relate this to the cultural differences. What we have seen, for example, in some of the cultures, we're basing our remote therapy on video and being able to see the child. And in some of the cases when the children are very young, it's based on the parents' involvement. So we need a lot of times the parents to sit behind the child or hold the child. And some of the cultures that we have are working with, they don't want to be seen on video. They don't think that it's modest, and that's not something that they would want. Another cultural challenge is the ultra-Orthodox don't always have access to Zoom or to video-based therapy. And so in those cases, for example, one of the things that was done is it was a dyad with a parent and a child and a therapist through telephone. Even though it wasn't the most best setup, both parent, child, and therapist felt that it was beneficial for the child, and there were gains, even though it wasn't optimal.
It seems like there's another question on whether you use creative art therapy remotely also.
Yeah, we have a very creative teacher, an occupational therapist. I'll talk about the occupational therapist, that she learned all of the different attributes of Zoom. I don't know if you know or not, but Zoom has whiteboards. Zoom has the ability to draw together, to use the different programs that are on the computer, and being able to give a child remote control over the mouse of the therapist. The child could then use different programs, for example, for drawing or for using different symbols or stickers, to be able to do that. Other opportunities of using creative art through remote therapy is animation, using animation programs and creating together short stories, short movies, and being able to share that with peers in the classes.
Does anyone else have questions? I think we've answered either coming through the Q&A or coming through the chat. Okay, well then I'd like to thank you so much, Dr. Gefen. This was a terrific presentation, and I'd like to also thank you for all the great work that you are performing at ALYN Hospital. For everyone on this call, yes, sorry.
Thank you, that's all I said.
Okay, thank you. For everyone on this call, we will be distributing a video of this presentation to all of you tomorrow morning, where you will also have the opportunity to donate to ALYN if you feel so motivated. I know I will. And please look forward to the next in our series in June, and don't hesitate to forward this video to your friends, families, and neighbors and invite them to the next presentation to help us spread the word. Remember, it is our support, their success. Thanks again, everyone. Thanks, Dr. Naomi. I found this fascinating. Hope you all did as well. As I said, our support, their success. Thanks again.